When we first opened up our pharmacy in October of 24, our first patient was a diabetic and he was without his meds for 6 months. He had $1,600 worth of copays and I got him to zero. The guy was struggling. He was in a bad position, came to our pharmacy and did not leave because he could not stop crying. And those are the things that we're there for. So and we can make a big difference in people's lives.
Welcome to In Good Company.
Ryan Kruger is driving innovation at Jordan Valley Health with a shared commitment to expanding access to care. Ryan is Vice President of Operations and a longtime pharmacist, bringing nearly 30 years of experience and a passion for solving real-world healthcare challenges. He's also helping launch new programs and technologies that improve access for patients and families. He is working to rethink what community healthcare can look like and how it can better serve everyone here in the Ozarks. Ryan, thank you so much for joining us for our show.
My pleasure. Thank you for having me.
We're so glad you're here. I think everyone's heard of Jordan Valley, but they may not know everything that you guys do, how you kind of got started. Can you give us a little history?
Yeah, so we're fastly approaching 25 years in the community. Jordan Valley started up on Kearney Street a long time ago with Dr. Bentley and Brooks Miller, and quite quickly migrated down to our Tampa campus as where we reside in one of our 10 locations right now. From Kearney, we moved to Benton and then quickly moved to the Tampa location. So being in the community 25 years, we just break down barriers on where our patients need us. And that's the most important piece. And that really lives our mission to provide access and build relationships. And whatever fits that mold, we have the autonomy to go out and solve those issues, whatever the patient needs.
So in the traditional healthcare system with the two major hospital systems that we have in our area, what gap are you filling?
Well, we complement each other very nicely. So we have recovery care navigators in Cox and soon to be Mercy in their emergency rooms to help with patients with substance use. So we have a 7 a.m. to 7 p.m. walk-in substance use clinic. We have to be ready when our patients are ready to quit and our providers take those walk-ins. But we place people in the emergency room to get them back to that center to be able to help them on their journey for substance use disorder.
And that's in the emergency room at Mercy and Cox as well?
Yep.
And Cox North, they have an emergency center?
Cox North does, but we're at Cox South.
Got it. Okay.
Yep. Good clarifying question there. We obviously collaborate with PACE, and we'll talk a little bit about PACE and break that out. But we also collaborated with Cox up in Buffalo. So Cox has a clinic up there, a space that they lease to us now, or we operate with them. So that's co-branded, and we're helping in the Buffalo community. Specifically, the big lift there has been dental. So we added our dental services, and that's a big service that community needed from us being there.
Nice. Well, a pharmacist in a administrative role, tell us your path. How'd you get to where you're at?
Sure. Started with Walgreens a long time ago, 1994. Okay. Graduated pharmacy school in St. Louis in 96. Stayed with Walgreens for 29 years. So I was a bunch of different leadership roles there. Started as a pharmacy supervisor, transitioned back and learned the front retail operations, became a district manager, then became a director of pharmacy operations. So when I left, I had 84 stores and it was about $800 million in revenue.
Wow.
So a pretty big chunk throughout Missouri, Kansas, and Arkansas. Back in 2014, I actually purchased Jordan Valley's pharmacy from them and made it a Walgreens at the Tampa location. So at 440 East Tampa, Walgreens operates store 16250. That was 10 years ago that I orchestrated that deal and started my relationship with Dr. Stinson and Brooks Miller. Since then, just kind of evolved and continued my network. I was a part of a reduction in force at Walgreens. They've gone private since and a bunch of different changes. But as I was transitioning there, Brooks Miller was there to offer me a job to open the PACE Center. And from that, it's been history.
Good call.
So two and a half years. Yeah. 2.5 years with Jordan Valley, and just a lot of change and a lot of fun and a lot of autonomy that I didn't really have at those latter parts of my career with Walgreens.
Now, tell us about your position right now. Like, what are all the things you're in charge of at the moment?
Well, this is a loaded question, John. So
Your day-to-day.
Yeah. As of today, my title is Vice President of Operations. As of April 20th, I become the Chief Strategy Officer.
Nice.
So we're transitioning. Today, I have everything at the Grand and Kansas Clinic, which is peds, women's health, integrated dental with both of them, ultrasound lab, therapy, 4 operating rooms, vision, pharmacy, and PACE.
Wow.
And then over at the main campus in Tampa, I also have patient-centered health home, patient-centered medical home, and population health. So all that falls underneath my umbrella today. Come April 20th, I'll also take on HR. And then the Chief Strategy Officer will be all of the strategic plans that we implement. I'll be in charge of making sure those come to life April 20th.
Wow.
That is a lot.
Yeah.
How do you balance everything out?
You know, it comes with a lot of strong leaders underneath me. So I trust and empower them. And once that happens, the magic really starts. Yeah. So once you trust and you can and just say go and fix problems, and they do it, and we learn from any mistakes that we make, it is so much better, and things flow so smooth after that.
So if you imagined a kind of a pie chart of the services that you're in charge of, what are the biggest pieces, I guess, of that pie chart?
So in terms of revenue?
Well, I guess in terms of manpower and, operational, we have 3 services in our business, and some take on a lot more complexity than others for different reasons. How is Jordan Valley's pharmacy? Are there differences between Jordan Valley's pharmacy and like a regular retail pharmacy like Walgreens?
That's a great question. So back in 1992, 340B was passed by the legislature, and that gives us access to lower cost drugs directly from the manufacturer. Okay. With that access, I can purchase drugs for pennies on the dollar, but then I can also eliminate some copays for patients and provide a lot more accessibility to affordable drugs. And that's really what was meant by 340B. So if you see a Jordan Valley provider and you go to a Jordan Valley pharmacy, I have a bunch of keys that I can turn to help people stay compliant on their meds, keep them out of the hospital, and keep them healthy. So that access to the lower cost drugs is a big, big benefit. When we first opened up our pharmacy in October of 24, our first patient was a diabetic, and he was without his meds for 6 months. He had $1,600 worth of copays, and I got him to 0.
Wow.
The guy was struggling. He was in a bad position, came to our pharmacy, and did not leave because he could not stop crying. And those are the things that we're there for. And we can make a big, big difference in people's lives.
That's so cool. So there's some people who are going to be listening right there going, hey, I'm going to go get my pharmacy at Jordan Valley. Are there limitations on who can actually purchase from Jordan Valley to get their pharmacy?
Absolutely not. So any contract now that any PBM has, for the most part, we take. Okay. So we just got access to TRICARE. TRICARE was a pocket that we weren't able to accept, and now that we're going down this accreditation piece for specialty pharmacy, Express Scripts let us into that contract. So you don't get access to the discounts unless you see a provider at Jordan Valley.
Okay.
But if you do have commercial insurance, you can see a Jordan Valley provider, and we can help you with that copay assistance. So there's a win-win with that, but you have to establish as a patient with Jordan Valley,
okay,
which is the covered entity under the 340B legislature.
Okay.
And then the pharmacy would be able to help you with that copay. So those people that are listening that are struggling, we'll be glad to help you. That's the purpose of us.
We're going to give your information out on in the show notes, and make sure you might get some phone calls.
Yeah. Medicare Part D, Medicare plans. We take them all on the medical side. On the commercial side, on the dental side, we have very few commercial plans. It's just Medicaid and a select few commercial plans.
And where are the pharmacies located?
So I only have 2 right now. The first one, the one closest to us is 1720 West Grand, the old Price Cutter or Dillon's location. at the corner of Kansas and Grand. Okay. And then we have one in Lebanon on the North Clinic in Lebanon. So we have a long runway to expand in that pharmacy. And I think that probably comes with the experience that I bring. And that's probably the easy button because I've hand selected from the teams that I've worked with before, and they are very easy to work with. And we all pretty much align. I think I've just hired our 13th pharmacist in 2.5 years. So wow. that expansion is going pretty quick. We have opportunity to continue to grow there. We're going through a URAC accreditation for specialty pharmacy and a bunch of other opportunities. But Aaron, Brooke, Amy, Alicia, my team over in the pharmacy, they're just rock stars and they run with it. So big growth, big lift, but I don't have to do a whole lot there. They pretty much self-manage themselves. In terms of personnel, PACE is my heaviest lift in terms of the home care aspect, the interdisciplinary team, keeping them all organized. And I think between PACE, I have 42 employees at this point in time from nothing. And my pharmacy, I think we're at 18 right now. So
okay.
I mean, you can kind of tell the difference. But the pharmacy revenue is really driving everything.
Let me switch to the PACE program. Mm-hmm. Most people don't know anything about they hear PACE and they have no idea what that is. Can you help describe it to somebody who's never been exposed to it?
Sure. The funny story, August of 23, I was sitting there 29 years in healthcare, and Brooks Miller walked past me. He goes, "Hey, I want you to run my PACE program." And I was like, "What are you talking about?" And he goes, "So just look it up." He goes, it was a dedication to his monument outside the Grand building. And it was hot, and he was just like, "I want to get out of here and go to dinner." So I Googled it, searched it, and I was like, "Oh, this is interesting." PACE stands for Program for All-Inclusive Care for the Elderly. And ultimately, it's a capitated health plan that we run. The majority of the participants are dual eligible, meaning Medicare and Medicaid, which means no out-of-pocket costs for them. And they get everything covered in terms of healthcare by our plan. So we're on the hook. We're incentivized to keep them healthy and out of the hospital. And our mantra is to allow them to age in their home safely and keep them out of the hospital. So we know what COVID did with nursing homes and the stays there and the cost difference. We're about a 14% cost savings on a nursing home stay. But more importantly, we unlock an opportunity for these participants when they come in to socialize, to get access to daily clinic care, and also access to therapy care on a daily basis at our day center.
Yeah, Alex and I had an opportunity to come tour. It's a beautiful facility. We were super impressed how just clean and organized. And there was just so many, I had so many questions while we were even there. We didn't have enough time. But one of the things that I think some people might be curious about is, how do you qualify for PACE?
Yeah, that's a great question, John. We have a level of care assessment that basically qualifies you for nursing home level of care. So Connie, our intake person, will go to the home and do that assessment. As long as they score a certain amount of points, 18 on that level of care, we submit it to the state. The state reviews it. Then they get qualified if the state signs off on that. And then we sit down and we talk about what enrollment would be for that participant.
Okay. And how many people do you have in it right now?
Currently, this month's census is 85.
And what's the max number you can take?
So our certificate of occupancy at our current location is 135. That means 135 in one single day at the day center.
Okay.
But most of our participants come on an average of 2 days a week.
Okay.
So that number we think could reach somewhere in the 300 range.
Oh, you got a lot of room to grow.
A lot of room to grow. And we're growing across the street. So we're moving to the Walgreens location at 1930 West Grand. For those of you that see the construction and wonder what's going on, that will be our new PACE center. We'll vacate the space in the back at 1720 West Grand. That will become a dental pediatric residency program for Jordan Valley. And then we'll move across sometime in the early summer months here.
Okay. And if you hit that 300 mark, so to speak, with the number of participants, are there any other plans to expand?
Yeah, we have multiple sites already in process.
Okay.
So we're looking at alternate care sites, they call them ACSs, plus being able to expand. So in the state of Missouri, once you get your three-way agreement, you are basically exclusive for that 60-mile radius. So we have that center with Springfield, but we're looking to grow outside of that so we can continue to get a reach out into more communities outside of just that Springfield reach.
Okay, so I'm an individual who's coming to you. I'm just signing up for PACE. What are all the services that I have access to?
Yeah, so let's say we sign the enrollment agreement. You're going to come in, probably spend about a half a day, and you're going to meet with 11 disciplinary team members that are required by PACE regs to do a full care plan on you. So you'll come in, we'll put you through PT, occupational therapy, speech, dietitian, recreational therapy, home care, medical. I should always just keep this as a flip chart with me, but
That's a lot.
To name the 11 off
great.
Every time is always so fun. We have clinical pharmacists on staff with us. They all put together a care plan, and that care plan will then dictate what happens for the next 6 months.
Okay.
Based on your care being consistent or improving. With the day center attendance, we do a points system. So ultimately you could qualify for 1 to 3 days at the day center, 2 to 4 days, 3 to 5 days. And that basically all depends on, can you be at home safe by yourself throughout the day? Do you need us there? Do you need to be here for socialization? Is it a clinic need that we need to keep an eye on you every single day? Is it fluids? All kinds of different opportunities that come forth through that care plan.
That's amazing. And this is all covered. Just all they have to do is qualify under they're dual eligible under Medicare and Medicaid, and they get all these additional services.
Yep. Plus prescriptions with no deductible and no copay.
Wow.
That's all a la carte in there.
This is way better than like other insurances, like even Medicare Advantage, even some of the perks that they say they offer.
Yeah.
This is way more than that.
We do compete with Advantage plans quite a bit. And I think those enticing gift cards that go out tend to keep people, sticky with the Advantage plans.
Yeah.
But we do have opportunities. So we do have a full kitchen. We do send people home with meals, insecurities around food. We do find all the resources. We have 3 social workers right now for any utilities opportunities that they have. We do trips on our transportation. One thing I didn't mention was we have a full transportation team to take people to and from, all included.
Nice.
So we have a fleet of 10 vehicles right now, and I think we're sitting at 11 drivers that are picking participants up throughout the day, taking them to appointments. They'll go and see Christmas lights together. They'll go to the grocery store, and our dietitian, Jessica, will take them and teach them how to shop for healthy foods. A lot of hands-on and a lot of interactive things that people just didn't get to experience. I remember a story for Halloween. We picked up, we had about 13 people, I think 14 people sign up. They wanted to go see Halloween lights. I think there's a place down in Nixa that goes all out. We took them to Andy's first. And, I think growing up, having 2 kids, they're 19 and 21 right now. Andy's is a staple. Here we had some older adults that were 55 or older and never been to Andy's.
Oh my gosh.
And taking them and splurging some ice cream for them.
Yeah.
It was just the smiles that you saw on their faces, and the experience was priceless.
So cool. Boy, I don't think people realize what a great program this is, because I mean, when we're in home care and we think about all the support things that you have to put in place to keep people in their home, and you're hitting all of the boxes. It's really awesome. You are a nonprofit, but you are still a nonprofit business. How do you balance your mission with margin?
Yeah, that is tough. No margin, no mission. And that is a statement that we say quite often. But ultimately, we have to make sure that we're on top of our finances, on top of our budget. We do have lost leaders. We do know that those lost leaders are a necessity in our community. We do have some grant funding that supports us, but very little. Jordan Valley and their leaders that set us up to where we are today has us in a great cash position that we can sustain a lot of shortcomings in terms of like grant funding and those types of things. We're self-sustainable. We don't need that. But that's just from discipline and making sure that we're going to continue down that path with good financial stewardship.
Speaking of that, how do people, if they want to help with your mission, what are the best ways in which the general public can help?
Yeah, it's great. It's relatively, I guess it's not new because I've been on the foundation board for about 7 years, but Jordan Valley does have a foundation. We do have crisis funds that we help our employees and our patients with as well. So if you want to, there is a landing site to donate on our foundation page. And that's can be found at jordanvalley.org or on the Jordan Valley Foundation webpage.
We'll put that on the screen too so people can link to that. That's awesome.
Yeah, there's a quick QR code or there's a quick donate here.
Okay.
There. So
do you guys do big events or anything yet?
we have not.
Okay.
Yep. So we are we're trying to navigate those waters and figure out where we go and how we do it. Christy Carter's taken over our executive director role at the foundation. She's doing an amazing job. And she is starting to lay the foundations as to how we want to go about events, or do we want to do just certain things like naming rights or other pieces like that. But ultimately, it's about getting the community to understand what Jordan Valley does and how they impact the community.
Yeah.
And that's the most important piece.
I love that.
Ryan, what is one problem in healthcare that keeps you up at night?
Oh boy. The vaccination front, the preventative medicine front, those things changing as rapidly as they're changing is really scary on that pediatric side. We're preparing for a measles outbreak. And that's just one aspect of it, but hope it doesn't happen, but it's close enough that we could have an opportunity here with certain aspects of our community that don't vaccinate to be ready for how do we handle a measles outbreak, and we'll be ready for that. So I think just those quick changes and probably that reflex from COVID and the things that are happening is some of the things that probably are really keeping us awake right now. I think the other thing is just access. I think we've talked about do people know about PACE, and really getting the word out about PACE and how do we take care of people differently. Yeah. One of the stories I think I shared with you, John, when we were at the PACE Center, we helped someone put on 20 pounds, and it was a female participant, and you would say, well, is that good or is that bad? Well, she was severely malnutrition, and she ultimately has told the story multiple times that she wouldn't be here today if she didn't have us. Yeah. And that nutrition piece or that access to other things is so critical. And there's so many people needing that out there.
Oh boy, I can only imagine. So can you tell us a little bit about the housing aspect of what Jordan Valley does? Is there a component there?
There is not.
Okay.
Yeah. So that is something that's on our radar.
Okay.
We are meeting with multiple community partners and would love to continue to talk. So if somebody's out there listening, we are continuing to try to figure out what we can do. We do own some land around the Grand building. There's about 14 acres there at Kansas and Grand that we would love to figure out how to develop or other things in the community. But we have homeless patients that should be PACE participants, but we can't track them down or put them in and can't help them. So I think those are avenues that we want to figure out and how do we help. We also have a huge opportunity to attracting providers in the area and having housing for them. So think of residencies for the dental side and the medical side, and how do we attract a resident to come and practice here and stay here afterwards.
Yeah.
I think we're working with Cox and Mercy on the same opportunities there. And then our own employees, fall on financial hardships, and housing would be something that we would help for them as well. We had a medical assistant 2 days ago have a fire and lost everything.
Oh my goodness.
And, just trying to figure out where we can put her and support her right now is key.
Yeah. Well, we just did a podcast with the Victory Mission, and there was this kind of component of talking about one of the fastest growing homeless populations are people that are over the age of 55. And, we see that number growing substantially over the next decade. And so that's an area that's very interesting to us because we want to just see how the dots get connected as that population grows. And so some of them, they've got functional mobility issues, or they got, serious medical conditions, and some of them have mental health issues. So with the Victory Mission model, they're very much about enabling and trying to help people have a path to, working again and trying to get back in. And there's definitely still opportunity at that age, but there's still this kind of component of what if they're not able to, to work, and, where do we lead these folks that are homeless? They're getting up there in age. They really need a Jordan Valley. They really need a place to live, and trying to connect those dots as that population grows. Because I'm not sure, I think recently I read that we just broke 500,000 population in this area. And I think with that is going to come a lot more folks that are going to have needs there we have taken care of homeless, believe it or not. We've had people who were in motel rooms for a short time. I mean, we've had somebody who was practically under a bridge, that sort of thing. And, home health seems to be the last stop, so to speak, from the acute care aspect. It goes to the nursing home, and then, if they have a place to go, they send them to us, and sometimes they're staying with a friend or in a group home or that sort of thing. But then after that, sometimes we lose them, not lose them, we just can't find them, that sort of thing. And I'm sure you guys run into the same problem.
Yeah. Yeah, absolutely. I think one aspect in the community was Malia and her team at the kitchen and the housing they did on the north side. I mean, I was there for the ribbon cutting, and she filled that place up like that. Like the opportunities out there are so vast, and we have to put our heads together and really just try to fix that as a community together.
Yeah.
I think there's momentum on the city side too. Like that
I think so too. And I think, the nice thing about that podcast is Jason did a really good job of helping talk about some of the stigmas around being homeless. A lot of people are like, just get a job, and that sort of thing. But there's more complexity to it than that sometimes. Especially he had mentioned that there's just a lot of trauma related to homelessness and mental illness that's there. And so it's not a moral issue oftentimes, like they're just deciding not to work. There's more complexity to it than that, and trying to figure out how you support someone to get them to a point where they can kind of help themselves a little bit is kind of the hard part of piecing that all together.
Yeah, I think one of the things we're working through right now is we've got a couple, and I say couple, I don't even know the total number, but a couple homeless patients that see our behavioral medicine department. And one of their big concerns is like, hey, you're going to give me this medicine and I need to take it, but how do I keep it safe? So we're trying to explore lockers that they can come and go on a daily basis that they have access to that keeps their medicine safe. Yeah. Because that's what they've chosen, or they can't get the resources, right? So we have community health workers that help to find those resources to help them get jobs or other things in the community. But we have a bunch of barriers that all of our patients need. And the great part about Jordan Valley is Dr. Stinson says, go fix it if it's an opportunity. Yeah. Right. So we're currently talking about what do we do? And if we set up some lockers and they can access their meds on a daily basis, a weekly basis, whatever, I think that's a great solution. And there's other things that we can do in the community that might not be building them a house at this point in time. Right. But continue to get them access to that behavioral medicine or behavioral health care that they need. Yeah.
And is the foundation looking into that also, or is that a piece of it?
Yeah, we got a bunch of ideas for the foundation. Currently, the foundation owns a laundromat. Okay. So we have a laundromat at Kansas Square across from Hy-Vee. On Battlefield, that we do a bunch of different things. So we're out doing contracts with other businesses, but Jordan Valley spends a lot of money on cleaning towels and lab coats and different things like that. But now we've transitioned all of our PACE participants' laundry just to go to the laundromat and then come back. So they'll bring their bag in, and the driver will just drop it off at the laundromat. And by the end of the day, before they go back home, we'll have it done for them. So I think looking for ways that other people would partner with us in the community, that would also give us access to revenue that we can raise to put into the foundation to help people in the community in need.
You're moving more into strategy. What's coming down the pipeline for Jordan Valley in the next few years, or at least what's churning?
Yeah.
What are you thinking on pursuing?
Yeah, I think we talked a little bit about pharmacy already, but we have a gap in Christian County, and I think Dr. Stinson came out publicly on his Springfield Business Journal interview as like Christian County is going to happen. So we have to figure that one out. He went out and sealed the deal on that one. But we have a lot of different growth in a bunch of our different departments. So I mentioned we have 4 operating rooms over at our Blunt building or our Grand building. Those 4 operating rooms are not maximized at all. So we need a part-time ENT, and we want to do tonsils, tubes, and adenoids there. Maybe we could bring in a podiatrist to do some foot surgeries. We're expanding with women's health procedures. We're doing pain management in those clinics as well with Dr. Del Campo. So we've got a lot of opportunity to continue to serve the community and grow. There's a huge opportunity to have a trusted pharmacy near where that participant or that patient needs us. And, right now there's so much transition. I don't know if you've gone to a pharmacy lately and it's closed because they don't have a pharmacist or
many times
it's closing or you're sitting in a drive-through forever. Like my anticipation is you come see a Jordan Valley provider and then you go home and within 24 hours, I deliver that med to your home.
Wow. So cool.
No stops.
So
right.
Cool.
And we just trust it. And that comes with the consultation. And we make it easy for you.
Yeah. I actually had this same problem. I stood in line forever. I won't mention the pharmacy and didn't get anywhere. So I went back on the app and said, I'd like this delivered, in the next 2 or 3 days or something like that. It said it was delivered, wasn't delivered. And then called the pharmacist and they're like, yeah, they never picked it up, and I think they use something like a DoorDash or something.
Yeah. Uber Health or something.
Yeah, something like that. But I mean, I didn't know that they do that. I just found out from the pharmacist or whatever. But those situations, that was my one anecdote, but it's one of those things where, it's pretty nice to have something delivered to the house for some of these folks, big time.
Yeah. And for us to grow with the population and the things that are happening, you mentioned, 500,000 people. It's just not low income that we see. And I think we have a huge opportunity to see other patients. We're starting a telehealth rheumatologist next Thursday, actually. So currently, I think, don't quote me on this, but it's 8 to 10 months to be seen by a rheumatologist once you get referred. And we're gonna cut that time down to less than a month.
Wow.
And
okay.
We're gonna provide telehealth for rheumatology and provide some access there starting next Thursday. So different opportunities that we can cut down on referrals and how to keep people sticky within the health center and really just provide a full wraparound service. And we talked to, I think I used the catchphrase, but from womb to tomb in the Blunt building at Grand, from somebody walking in and getting a free pregnancy test and finding out that they're pregnant, getting all of their OB care, delivering the baby, transitioning them to our pediatricians in that same building, and then growing into family practice, along with the wraparound service of express care. Jordan Valley has it all. And we should not have anything really leaving there to complement everything that's going on at the 2 hospitals here in Springfield.
That's awesome. So speaking of the tomb part of it, you're taking care of folks in the PACE program. Do you do hospice?
So we do. So what we learned quickly was our care plans are typically way more intensive than what hospice is actually bringing. I don't want to throw any stones out there for any of the hospice people out there, but at the end of the day, if we're going 5 days a week and hospice is coming 2 days a week, is that needed, right? We needed some specialized training on end of life and those types of things, and we went out and got that. We'll partner and do those things, but for the most part, at this point in time, we're trying to do it all in house because the family has become very acquainted with us, and we have a lot of relationships that we're building with them that really helps them through that end of life process.
Yeah. Well, you're strategically placed, especially with your pharmacy. Like, that's really amazing. And I love that you can, like, being able to take somebody through several phases of their life and have an impact on that. Because, having, a new baby and then their grandfather can be still served in, practically, feet apart more or less. And that's pretty neat.
Yeah. Yeah. And, the PACE program is unlocking all kinds of different opportunities and different stories already from that. And, people remember and talk about us being up on Kearney Street and coming for the first time. And it's just interesting. You come sit and hang out in the day center and hear those stories as the journey of people. There's so much wisdom. There's so many thoughts that are out there and conversations that happen. I just love to just hang out and talk to the participants in the day center.
So if somebody was interested in trying to find out more about the PACE program, what's the best way for them to reach you guys? Yeah,
so the best way is our phone number. And you're going to ask me that, and I'm going to have to put that on there.
We'll pop that on there.
And then also our website. So we have a form that you can fill out that takes you right to Connie, who's our intake coordinator. And as soon as that submission goes through on the web form, we all get an email, and then she starts her work on those referrals.
Awesome. And from how long from application does it take to get approved to be in the PACE program?
So it depends. There's a lot of coordination and a lot of work that goes into that. So, we got our first email for our first participant for the month of May. So in April, we're enrolling for the 1st of May. So ultimately what happens is we have till the 5th last business day in the month to enroll. So they get disenrolled and everything else. So they'll come out of their traditional Medicaid, they'll come out of their Medicare Advantage plan or whatever and get enrolled in PACE. Those entities need 5 days to do that transition for us. So today is the 7th, and we had our first 2 participants sign on the dotted line already. So some of those processes go really quick. They came in on the 1st, so like 6 days from start to finish. Some of them take a lot longer because of Medicaid spend downs and different things. One great thing about Missouri is they've worked with us greatly on the Mo Health Net side. So we're going to change. There's not going to be a spend down for Medicaid patients. The income limit will increase to $1,690 from like $1,120. Don't quote me on that number. So about a $500 a month raise on the income, and then a total elimination of spend down. That spend down is usually what deters people. So we have this bucket of people that are waiting for that spend down to go away. Now that it's been approved, we just need to get the state to finish that, and then we'll have, probably another 50 or 60 enrollees ready to go. A lot of the legwork's been done on those people, and they'll just be ready to sign on the dotted line. So sometimes it comes down to financial aspects. Sometimes it comes down to, hey, this is too good to be true. Let me experience it a couple more times. So we'll have our drivers go out, pick them up, have them hang out in the day center, make friends, and then we'll figure it out. I think the longest one that we've taken from start to finish is about 6 months. I think the fastest has been about 3 days.
Okay. And occasionally we'll run into a patient that's in Medicaid pending. Do you guys have to wait till that is completed before you can move forward?
We do have a little bit of a fast track there as well. So Connie is my guru, and she gets a direct access to the enrollment people.
Oh, nice.
Yeah, so like I said, we're in good graces, and the state of Missouri understands the benefit of PACE, and they're invested in it. And we're grateful that they're great partners with us.
Yeah, that's awesome.
And they've been just absolutely fabulous to work alongside with. One thing that we do have at Jordan Valley is that assistance for Medicaid applications as well.
That's great.
So we did not talk about that earlier, but if you do have somebody that needs assistance in getting Medicaid, we'll help them see if they qualify, and then also enrollment.
That's cool. So with the two other large healthcare organizations, you already mentioned having someone available in the ERs. Are there other partnerships that you're pursuing with the two organizations?
So we do partner with the residencies with Cox.
Okay.
So we do have medical residents that we partner with currently. Cox also does allow us, we signed a contract with them and allowing us to have our OBs deliver our babies over at Cox. So currently, we're having a pretty good clip of baby deliveries from our 3 OBs. That's new to us as well. Since I've been there, before we would see them for their prenatal care, and they would choose, and then a hospitalist from Mercy or Cox would deliver. We feel like there's great value in building that relationship, and then that warm handoff to the pediatrician afterwards.
Yeah.
And Cox has partnered with us on deliveries for that. So that also gives us access to robotic surgeries and different things for women's health needs. That happens
cool
as well.
Yeah, that's really neat.
Wow. During the season of growth and transformation with Jordan Valley, how do you keep your employees energized and aligned with your mission?
That's a great question. And it's really heavy on my shoulders now, taking on HR and strategy. But I think, I know the firm answer to that is clear and transparent communication. The more that they know the direction that you're swimming in, you get people aligned, and you work through that. Not everybody's always going to agree, and some people will be in that valley of despair, that change curve. We just got to get them through that. We're sitting just north of 800 employees right now. But my key focus in that strategy officer role and the HR role is transparency around, this is our strategy, this is how we're getting there and where we're going. And that's going to be our engaging factor. My mantra is I want this to be one of the best places in Springfield to work. I know we've got a lot of work to do to get there, but we're going to focus on that.
Awesome. And what keeps you grounded?
Oh gosh, anything outside. Love to be outside and just work in the yard, play golf. But if there's a sunset or being out in the sun, get up early in the morning, walk my dog 3 miles, get my workout in, get some exercise. But being outside and just enjoying family and friends.
That's awesome.
Right on.
So I think the great opportunity, we talked about Buffalo already, but we have 10 clinics across Springfield, Southwest Missouri area. So in Lebanon, we have 2 clinics. We call them Lebanon North and Lebanon South. Lebanon North is a partnership with Compass Health. So they take care of all the behavioral health stuff and behavioral medicine. We take care of dental, primary care, and pharmacy. And then on Lebanon South, we have a pediatrician and women's health. And then we also have an early childhood, so like a daycare that we have partnered there. We also have a clinic in Marshfield. We also have one in Republic and in Hollister. And then we have 4 in Springfield between Benton, which is our substance use and our pain management clinic. One thing I'll mention there is we have a free Narcan vending machine.
Okay.
So just walk up to the machine, punch in your zip code, and out comes a Narcan dispensed to you. We also have one of those in Hollister and Marshfield. So
that's amazing.
Great opportunity in the community. Not a lot of people know about it, but I think it's very important to always have Narcan on hand, and can be a big lifesaver. Then we also have our Tampa location, which has express care, dental, medical. We have behavioral health, behavioral medicine, vision. And then we have the Walgreens pharmacy there. And our Blount Grand location, we already covered all of that. Our Kingsley location, which is over by the field house, is all dental now. So it's catered around special needs and dental services. So I think we're going to have 27 chairs there. and really just booming business down there. And then I said Hollister and Republic. So those are the communities we're in right now. I did also say that we're missing that gap in Christian County. So
That's coming soon.
More to come.
Coming soon.
Yeah.
So for any of the providers out there, what positions are you currently looking for, and what areas?
Yeah, that's a great question. Always hiring. Seems like we're always interviewing as well. The chief medical officer role is a priority, and we're interviewing currently for that. But needing MDs or DOs is critical at this point in time. We do a pretty good job in nurse practitioners and PAs, but that collaboration, we need some doctors in with that. So family practice, express care are big points, and then we have some need for some dentists coming in. So we have about 75 medical providers and just north of 30 dental providers currently.
Okay. And I always ask this because this always has something. I always think about this whenever we're hiring: flexibility. So you may have somebody who's working full time somewhere else. They're not really necessarily wanting to leave their practice, so to speak, but they may be interested in contributing to the community by working for Jordan Valley. Do you have things that are kind of flexible as far as positions?
Yeah, I mentioned that ear, nose, and throat position that we want to fill at our Suite A at the Grand Building. That's just a part-time position. So any ENT provider that's working at Cox or Mercy or anywhere near, we would partner with them and free that up. I think there's a pretty long wait for tonsils, tubes, and adenoids, and that would really give us some flexibility to use that space and get through some kids and help them out with anything that's going on in terms of their hearing pieces. But we have people that work in multiple locations, and we partner with them as long as it's just not a competing entity where we're going to steal patients or anything. Dr. John works with us as well as the ARC. So we got people working all over the place, it seems like.
Yeah, that's awesome. That's really good.
And what's that website one more time?
For Jordan Valley, jordanvalley.org or jordanvalleyseniorcare.org will get you to finding those opportunities and the landing page for our job site.
Well, it has been amazing. I tell you, for future podcasts, we should probably sit down and dig into the pharmacy more. I have so many questions around that. The industry itself is, there's some transparency there, but there's some opaque for the general public, and trying to understand why things cost the way they do and access to it, and just understanding a little bit behind the scenes there would be really helpful for our listeners, I think.
You're going to pin me up against the PBMs?
Well,
that'll be my stance. But
I mean, it sounds like you're trying to overcome some of the biggest complaints that people have about pharmacy, and maybe you could just speak to that just briefly about kind of where you think the direction of that has gone from where it used to be. And my dad was a pharmacist, and he saw the industry change significantly, and he's gone now. But I think if he saw the way it is right now, he'd be shocked by the costs that some people are hit with. And it sounds like you're trying to help people overcome that.
Yeah, I think that's the number one mission, like making it an affordable medicine. We've got the access to the lower costs, and how do we help that? The missing link or the problem there to me, and I'll go on my soapbox, but we can get that cost directly from the manufacturer, and that's discounted. As soon as you put that aggregator, that middle person in the PBM, then we start losing transparency and we start seeing elevated costs. From my perspective, and that's being in retail pharmacy for 29 years and now leveraging it through the health center. I think one thing's consistent from my eyes from the day I became a pharmacist till today is nobody wants to give up that personal free access. And I don't think people think about pharmacy as the most accessible profession in the healthcare field. You literally can walk up. If there's a pharmacist on duty, they're going to talk to you. They don't make an appointment. You're at the beck and call of the consumer that's at the counter.
Yeah.
that puts a lot of stress on that profession, especially during COVID, and it caused a lot of burnout because we were doing shots, we were doing testing, we're doing counseling. You're trying to help people through all of that because you are accessible.
Yeah.
For the longest time, it was the most trusted profession because of that accessibility.
Yeah.
And, some things kind of shifted in that with the most trusted profession because of access and long lines and those types of things.
Yeah.
But
They're just busy. So busy.
at the end of the day, we're taking more meds and we need to be more interactive to how do you not just continue to add meds. Back to my PACE participants, they average about 12 meds per month. And I couldn't imagine taking 12 meds per month for myself. And our goal is to eliminate that, like get them healthy enough, reduce any opportunities for polypharmacy, and really keep it easy for them.
Yeah.
So if it's a dispensing, talking machine, if it's a pill pack, whatever that is, let's get them to a baseline that says, hey, we probably don't need these other meds. If they do, perfect. But at the end of the day, in my mind, 12 meds per month is a lot.
Yeah.
And we have a lot of opportunity to help our patients and our participants live different through pharmacy.
Yeah. Yeah. And I mean, oh boy, there's so many things I have questions about.
Yeah.
But I don't want to take up all of your time. I do want to mention one just personal experience I had. We just recently took our 15-year-old twin girls to Portugal. And on that trip, one of our girls got like I think a sinus infection, more or less. And so we were in Lisbon at the time. We go into one of the pharmacies, and it was an amazing experience. Actually, it was like we were going to a doctor. Like they're like, I was like going to go up and ask for, showing him my phone, like what the brand was. I didn't have any idea what to get. And he didn't speak great English, but he spoke English well enough to QA us on like all of the symptoms and everything that she was experiencing. And then he made a perfect recommendation for the medicine that worked great. And I was like, boy, that I hadn't had that experience yet in a pharmacy before.
Yeah.
You're so used to just kind of winging it yourself for over-the-counter stuff. But he really took time. I mean, it was like, I don't know, probably half an hour.
Wow.
Like talking with us and making sure. Wow. He's like, these are the side effects of this, and this is and this is a level and I had no idea. I was like, I didn't know the brands or anything like that. But yeah, he did a great job. It was a great experience. And, we've done some traveling lately, and it seems like we've always needed some medical overseas. And I'm always amazed at sometimes how things are different in different parts of the country. But it sounds like you're trying to tailor things more to customer service the way things used to be. Kind of the classic pharmacy experience, and moving away from this corporate owned, let's churn it out as fast as we can type of thing. And that's one of the things we're noticing across the healthcare space is that, to me, and maybe I'm probably biased, that I think this has more to do with corporate entities being involved with healthcare and, bean counters saying, how do we increase shareholder value? It's probably not fair, but what I've noticed is that locally owned smaller companies, smaller pharmacies, smaller, locally owned, does seem to be better because they want to focus more on the customer experience.
Yeah. I'll give you my 2 cents on publicly traded companies, and it might make a whole lot of sense as to what's going on. But you have a Walgreens, a CVS, and you have a PBM, a CVS, Caremark. You have an Express Scripts, Cigna, whomever that is. They're really fighting for that one consistent pool of money as publicly traded companies. The only way that they can grow their earnings is fight with each other. So they get more lives, or they control cost. Well, the middleman at the PBM can control the cost the best because they decide how they claw back through direct and indirect remuneration, or what they charge the employer or what they charge the patient for their copays, the pharmacy just has to sit back and take it. So who's going to win out in that battle? Well, you already saw Walgreens go private because they couldn't do things and restructure under a publicly traded company because they had shareholders that they had to continue to report to. There's no difference with that PBM side. And there will be a breaking point somewhere.
Yeah.
But how long, how far? I mean, you have your Walmarts out there that can sustain things for a lot longer. CVS pays themselves with the PBM model and Caremark. All those things are competing factors. But really, once that started happening and pushing and pulling with that same pool of money, grow lives, control expenses, there's a breaking point.
Yeah.
And we have to go through that. So once the publicly traded companies have to respond to their shareholders and cut costs, that's when the patient starts getting impacted because there's less payroll, because that's your number one controllable cost. You can get into purchasing groups and shave some points in terms of buying drugs at a cheaper rate and those types of things, but ultimately it comes back down to payroll.
Yeah.
And what can you do? And that's where it strips you. So then you're looking for central fill locations to control costs. Then you're waiting for that med to come from Kansas City to get here for you to be able to pick it up. All kinds of fun things that have been tried. You know, even Amazon and the way that they're going into the pharmacy business, you know, some of their commercials are pretty clever. You know, a patient waiting in line. Why are you waiting in line? I'll have it to you. You know, at the end of the day, I still think people want to have access to that pharmacist.
Yeah.
And they want to be able to see them, feel them, touch them, whatever. And that is never going to go away, in my opinion.
I totally could not agree more. It seems like this self-service type healthcare, it's what it feels like to me, kind of rolls into an area that some people are going to push back on eventually. They do want a professional who's trained to help advise them. And, you know, and sometimes if you have polypharmacy, it does kind of roll into some kind of dangerous areas where you've got people who have multiple physicians and multiple scripts, you know, and if you don't have one person you can go to who sees all that and goes, whoa, wait a second.
Yeah.
These two don't go together. You know, I know they've got stopgaps, but we've run into problems where we've gone into a home and they're on medications that they should not be on together.
Yep.
A lot. And one other thing I'll mention is that, you know, we have a hospice, and so we pay for the hospice meds, and so we work with. We've always worked with local pharmacies. You know, first it was Family Pharmacy before they sold out, and you know now we're with Alps, and we have just found that experience so much better because we've got somebody that we can talk to about, you know, working on trying to help reduce costs where we can, but still provide a great service because we have to deliver those meds ourselves. You know, they deliver them for us, but you know, that sort of thing. But if we were working with some big corporation, there's no way we would not get any service like that.
Yeah, Don Melody team, they knock it out of the park. They've got a great business model, and kudos to the Alps team. You know, admire them from afar, and always competed with them at the Walgreens level. But that was one of the things that I lost, you know, with Walgreens was that autonomy to be the Don and the Melody and being able to adjust to the people in the community that needed you.
Yeah.
And I think you're spot on with those independents. We see it all over the place. Lawrence does a great job. I got a friend over in Marshfield, Joe Doherty, that owns Stanley's, and he does the same things, just cater to the people that need you and just operate a good business model.
Absolutely. Absolutely. Well, kudos to you and to Jordan Valley and to Dr. Stinson and the work that he's in his new role and work, you know, the things that you're working towards. We're looking forward to having you guys back on and seeing what comes down the pike in the next couple of months. I'm sure that a lot of things are happening.
Big things are in store.
Yeah, we'll bring some things to life here pretty quick, probably. So, yeah, looking forward to it, and just continue to provide new access.
So, for the person who's sitting at home, they may be dual eligible, and they're kind of growing concerned about where things are going with Medicaid and, you know, getting access to care and that sort of thing. What would you say to them?
Yeah, I would give PACE a shot. Reach out, schedule an appointment with Connie, let her come and do the assessment, and take a tour. We'd love to invite you in. Love to see the operations. Love to talk to you about what PACE can offer and how we can support you to age in your home and your community.
Awesome. Well, thank you again so much for
Ryan.
being here.
Appreciate you guys. Yeah, my pleasure.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.